Okay.
Okay, so we're going to be live na on mic you po. So let's turn off the mic and the camera po. And
Noted. Good luck, everyone. You can do this.
The Philippine Nurses Association has been in the service of Filipino nurses for almost a century now, providing a voice for the Philippine nursing sector. Founded as the Filipino Nurses Association, September 2, 1922, by a group of nurses led by Anastasia Hirontupas, the PNA is the lead organization that advances the welfare and development of globally competitive Filipino nurses. Guided by the core values of love of God and country, caring, quality and excellence, integrity and collaboration, the PNA aims to promote the holistic welfare of Filipino nurses wherever they are. With the interest of nurses in mind, the PNA provides an avenue for the discussion of significant professional issues impacting the work and life of nurses. The PNA believes that having adequate nurse-to-patient ratios, appropriate shift work of nurses, just and commensurate compensation, security of work tenure, positive organizational climate, and increased reputation in the healthcare sector are priority professional issues needing action that redounds not just to nurses but to patient safety as well. The PNA works with all levels of government, with local, regional, and national government agencies, including Congress and judiciary, to advance nursing as a profession. The influence of PNA is essential for the passage of significant legislation that have impact to nurses, the nursing profession, and the patients they serve. The PNA strives to continually advance the science and practice of nursing. All year round, the PNA conducts continuing professional development seminars to support in building capacities of Filipino nurses. The Philippine Journal of Nursing, the official publication of PNA, now was Scopus Indexed, and Western Pacific Region Index Medicus, a reputable international journal, has a rich collection of peer-reviewed articles. In 2019, the Philippine Journal of Nursing was inducted in the Nursing Journal Hall of Fame of the International Academy of Nursing Editors. Evidence is needed for policy and practice changes. PNA conducts research on nurses' welfare, with the results informing policy and practice reforms. National conventions and international nursing conferences are held not only to gather nurses all over the Philippines, but to build a stronger community of nurses towards excellence and professionalism. The PNA is every nurse's home. With over 90 chapters in the Philippines and 15 chapters abroad, the PNA caters to every Filipino nurse, wherever they are in the world.
The PNA is a nurses' unified voice. The PNA stands up when our Filipino nurses are treated unjustly and represent them in their fight against any form of abuse and unfair treatment.
We can, and we will make nurses' voices even louder. Nurses will have more influence and bargaining ability and will less likely to be ignored. We will make sure that we will get represented in the highest levels of government and decision making. With strong resolve and working together, Nurses can make a difference. Visit our website at www.pna-ph.org and sign up as a member today. As a member, you are entitled to the following benefits:
Consultation on socioeconomic welfare and political rights of nurses.
The PNA Legal Counsel is available for schedule of consultations and referral to technical legal advice on administrative and labor cases whenever necessary. The PNA members have the access to continuing professional development opportunities with discounts and PNA reading room materials and information,
as well as discounted rates in availing PNA dormitory. PNA members have access to the Philippine Journal of Nursing and mutual aid benefits.
PNA may give recommendations for local and international grants and postgraduate studies. Individually, nurses already make a difference to their patients' and clients' life.
Join PNA, and collectively, we will make a bigger impact for all nurses, their families, their patients and clients, and the society.
Together, we will raise the profile of Filipino nurses.
PNA does not care about nurses.
The organization itself does not care about our welfare.
This organization is irrelevant to us.
PNA is all about making money.
PNA. Pera nyo, amin.
You are not gaining anything from this association.
Corruption at its best. No help to nurses at all.
Who we are is who we were. Philippine Nurses Association, established in 1922 by a group of passionate individuals led by Anastasia Hiro Tupas, was envisioned to be an instrument to unite nurses in the country and serve as a platform for championing the welfare of nurses. As an organized helping community, the PNA has been an outlet for all Filipino nurses to discuss and address various concerns and issues affecting their practice of the profession and pressing matters affecting their rights as Filipino citizens. Today, PNA remains to be the only nursing organization in the Philippines included as a member of the International Council of Nurses. In 1951, PNA has sponsored House Bill 1097 that led to the standardization of nurses' salary and provided for the mechanism for automatically increasing the salaries of nurses working in government. In 1953, PNA also sponsored Republic Act 877 to provide a board of examiners for nurses and other provisions relative to nursing practice. And in 2002, PNA, in partnership with the Professional Regulatory Board of Nursing, was instrumental in the passage of our current law, Republic Act 9173. Recognizing the immense role of nurses as leaders in healthcare, the PNA held the first Philippine Nursing Leadership Institute seminar to hone the leadership abilities of nurse members so that they can contribute better to social transformation. The PNA, true to its mandate, continues to provide free legal assistance, scholarships, and mutual aid benefits to its members. This was clearly illustrated during Typhoon Yolanda crisis, where PNA officers went on site to personally visit affected nurses and provide them financial aid and other donations given by generous supporters of the association. In the latest tragedy that struck the country, the Marawi siege, the PNA has once more demonstrated its commitment to the nation by immediately sending a response team to Iligan City to offer assistance to the victims of the ongoing war. Over the years, the PNA has taken an official stand in delicate issues affecting nurses. It has been an active resource person in bicameral hearings on legal matters and has been the voice of nurses in situations where their welfare is concerned. Not many know that a mark of excellence on PNA's contributions in research to improve nursing practice is the Philippine Journal of Nursing that is internationally recognized by the Western Pacific Region Index Medicus, Asia Pacific Association of Medical Journal Editors, Philippine Association of Medical Journal Editors, and its Scopus Index. As an instrument of the PNA, the Philippine Journal of Nursing provides an opportunity for nurses in our country to share evidence that impacts our practice and improve patient outcomes. Due to the PNA's relentless efforts to secure the welfare and ensure the professional development of Filipino nurses, PNA was awarded thrice as the most outstanding accredited professional organization by the Professional Regulation Commission in the years 2003, 2013, and 2015. We are only 2 wins away from getting the Grand Slam award. This is the Philippine Nurses Association's continuing legacy, championing the welfare of Filipino nurses since 1922.
Ang programang ito ay inihahandog para sa ating mga Nars ng PNA o Pambansang Samahan ng mga Nars ng Pilipinas sa pangunguna ng Department of Nurses Welfare. PNA is the only accredited professional organization for nurses recognized by the government through the Professional Regulation Commission. Last year, 2020, PNA has been awarded as the most outstanding professional organization on its 4th time because of its most distinguished role of championing the professional growth and welfare of Filipino nurses. Thus, we stand proud to say that our nurses is the best for Filipinos and the choice of the world. Ito ang Nurses Welfare Virtual Dialogue na may tema karapatan, kapakanan, at kaligtasan ng mga nurse sa trabaho.
Lubos po na nagalak ang ating nursing community na ang ating minimithi na sahod ay naipatupad. It took us about 19 years fight to win our just claim for a rightful salary.
Medyo nabitin pa tayo doon, alam nyo ba yon? Naguluhan sa DBM Memo 2020-4 kung saan marami ang nagreklamo sa ating hanay dahil sa pagbaba ng kanilang salary grades.
Bago tayo sumalang sa usapin, may social interview po na ginawa ang isa nating research team. Panoorin po natin.
Ayun sir, again, I'm Nurse Bench, so under ako ng PNA kasi I am the chairman for all nurses organizations. Pag-implement ng SG15, tinitingnan namin kung naramdaman ito ng public. So, pero ngayon, nagjo-duty ka naman, public hospital naman yun yung, sir, under kayo ng public hospital. Public hospital naman. Yes, po. Pero, nung nag-start yung implementation ng SG15, may ilan din sa inyo na talagang from dati kasi nurse 1 sila. And nag-SG15.
21. Oo po.
SG15 na din yung naging sweldo nila from
SG15 na. Ano po sir, nagkaroon sila ng kumbaga na-implement siya pero late na po na-implement pero binayaran sila lump sum. Apo, kung ilang hanggang from the implementation hanggang sa from the approval to the implementation. So nagkaroon sila ng bayad doon po. Ilan lang din naman po yung mga regular employees po namin, mostly contractual na po lahat. Yung mga regular employees naman po na-implement na. Yung problema po yung sa mga contract of service. Kasi yung position po namin is nurse 1 pero contract of service.
Ano yung sir? Ano yung saan kayo nagbe-base ng sweldo? Parang like sa minimum ba or
ano po sir? Meron kaming monthly po na na fixed na like dun po sa amin sa provincial hospital 16,000 po. 16,000 po per month yung rate namin. That's ngayon siya 20 days per month na duty. Kasi sa yung na po kasi sir yung contract of sir actually po mga job orders po lahat ng nurses before. So nung yung na-change na po yung admin, yung bago na po yung governor. So parang parang ginawang contractual yung mga nurses. So initially 16,000 po yung entry. Hanggang ngayon po, ganun pa rin. Walang increase na nangyayari.
So yung mga regular employees, sila yung dating nurse 1 na SG11 and nung SG15 na, sila lang din yung mga naka-enjoy ng SG15.
Apo, sila lang din po. Sila po yung nabigyan ng SG15. Yung nurse 1 dati na regular. So far kasi sir, after nung implementation ng SG15, wala na pong naging regular employee. Wala pong promotion na nangyari.
So parang yung dating contractual
Bago na nurse 1 na na-promote, sir. Okay. Opo, sir. Ganun pa rin po. Renewable. Nagre-renew lang po kami ng contracts namin, sir. Yun nga po, kasi mostly yung iba doon matatagal na din, sir. Mga nasa 5 years na din, iba.
5 years na contractual.
Opo. 6 months po yung renew po namin. Contract renewal po. So, naiuban ng mga contractual na nasa mga 7 to 8 years na contractual gihapon. Kaya tungod sa politics, naiuban nga maapsan ka ng mga bagong sulod na ano lang, mga nasa mga 6 months to 1 year, nya taas na naikapit sa gobyerno. Mas naunahan katong mga walay kapit sa mga sa mga frustration karon sa mga nurses kay dili kaayo nila dili kaayo mahatag ang promotion na rightful sa mga nurses. Karon ang amo ang ginakuan wala ang mga contractual na alang sa mga 16,000 ang amo ang sweldo. Minusan i-deductionan pa na og amo ang SSS, amo ang PhilHealth, pati among pag-ibig. So sa isa ka bulan naalang mi sa mga 13 to 14,000 among manet. Kunya wala mi laing benefits kaptura og amo ang PhilHealth shares nga mo depende pod sa kita sa ospital. So wala mi hazard pay.
Yung hopes nyo na lang about SG15, ano yung gusto nyo sanang mangyari or about SG15?
Ang Samoa lang sir na unta ipa-implement sa DILG or sa local government na i-adapt nila tong law nga gipirmahan ni President na ang entry salary sa nurses is as SG15. With that, kahit na mga contractual may at least fair among compensation no at least mabuhi pud ang among pamilya karon nga pandemic kay naglisod pud may nga every time pag-expose me unya pag kauman ma-quarantine pa mi. Unya dili pa pud baya appeal sa accountings sa paghatag og kanang SRA kanang once ma-quarantine ka dili appeal.
Tama sir. And syempre bukod dyan sa SG15 gusto din natin na talagang mayroon tayong security of tenure, dapat hindi tayo job order or contractual, dapat regular position.
Yes sir.
Sige po.
Apo, unta.
Sige po sir.
Now, our honored guest to join us in trailing towards information and issues clarification is no less than our DILG Secretary, Honorable Eduardo Anyo. Ang aming malugod pong pagtanggap sa iyo sa Nurses Welfare Virtual Dialogue, Honorable Secretary.
Again, welcome po Ginoong Kalihim sa ating Nurses Welfare Virtual Dialogue. Ang tanong po namin, Honorable Secretary Anyo, ay base sa SG15 ruling. Sa batas, ito ay ibibigay retroactive January 1, 2020 para sa lahat ng nurse position. Ito man ay maparegular na empleyado, casual, contractual, full-time, part-time. Sa lahat ng government agencies, pati local government units na covered ng CPCS or Compensation and Position Classification System ng RA 6758, also known as the Compensation and Position Classification Act of 1889. While the national government has executed the SG15 implementation, it is observed that LGUs has an erratic implementation. NCR cities have complied while provinces are yet to implement. Ang tanong po namin is there a support directive from DILG to upkeep the Supreme Court ruling on SG15 implementation to all LGUs? How do our LGUs go about implementation of SG15 for nurses?
At the moment, we are just waiting for the DBM and DOH to finalize the joint guidelines on the SG-15 implementation for nurses. This would serve as our basis in walking our LGUs through a step-by-step process. We are certain that the DBM and the DOH are carefully studying and planning the next appropriate actions while keeping in mind existing laws such as the Philippine Nursing Act, the Compensation and Position Classification Act, and the Local Government Code. I'm also confident that they are also taking into consideration the 2022 implementation of the Supreme Court's ruling on the Mandanas cases.
Maraming salamat for illuminating to us that information, Honorable Secretary. Ang mga cities ng Metro Manila ay agad sila nagpatupad ng SG-15. Personally, na-check namin ang mga nurses na nagwo-work sa ating local city governments like Manila, Quezon City, Valenzuela, Caloocan, Navotas at Malabon. Then all the cities of NCR, lahat po nagpatupad ng SG-15 salary.
Sa mga provinces natin doon, Sir Neil, medyo hindi lahat at hindi sabay-sabay ang pagpapatupad ng salary grade 15.
Agree ako dyan, Ma'am Shirley, and the most reason why there is delay in the implementation is because of the budgetary constraints of the LGUs concerned. Wala silang maibigay para dito.
Tama.
Oo naman. Saan kukuha?
Ng pambayad.
Ng pambayad. LGU na, LGU. Speaking of LGU. Ang tanong namin, Sir Kalihim, is this. In instance where ang local government has limited budget and resource to be used for nurses, salary compliance, what could be the possible solution po ng LGU to take? And what help can the ILG extend to our LGUs of the same circumstance? Diba? Parang ang hirap pong isipin, Secretary Anyo. Paano po kaya, sir?
The DILG, together with the DOH, DBM, DOF, and PHIC, jointly issued guidelines on the allocation, utilization, monitoring, and accountability for the Special Health Fund, which was created under the Universal Healthcare Law to augment LGU funds for health. Currently, 58 LGUs nationwide are participating as UHC integration sites and shall be provided with technical and financial support from the NGAs. This would help them achieve managerial integration during the first 3 years of implementation and financial integration within the 3 years thereafter. Sources of funds include financial grants and subsidies from NGAs, income from PhilHealth payments, donations and financial grants from CSOs and IHPs, among others. The remuneration of existing health personnel under civil service positions will remain chargeable to the LGUs.
Sa usapin naman patungkol sa health services, particularly at the LGU level, samut-sari ang ating nakikita at nararanasan. Pero sa karamihan ng ating nakikita, hirap ang ibang LGU na mapaisulong ang maayos na serbisyong pangkalusugan.
Para tumbukin ang ibig mong sabihin, Sir Neil, kakulangan sa budget, pangkalusugan ang dahilan ng mabagal o mababa na level ng health service sa ating mga devolved health units and hospitals. Pero po, we emphasize we are not speaking here in general terms. May mga LGUs din naman na ipapaangat na maganda ang kanilang health services.
Agree ako.
Tama ka dyan, Ma'am Shirley, kasi sabi nga daw ng karamihan ng mga senior nurses natin, most especially sa provinces, malaki ang difference the time when provincial and district hospitals were under the DOH.
Yes, that is true. Baka hindi ka pa noon pinanganak, Benji. Nung effective sa amin yan.
Naabutan ko yan.
Di ba? Yes, ang devolution ng health services. So, I guess ang ating health service is one basic service of the government. So, intervention of the pandemic somewhat caused a seaway in the government's tooling and strategizing for the implementation of the universal health care, which has become a law on February 2019. Nung nasa 2019 tayo, lahat patungkol sa universal health care ang tunog, no, ng mga usapin. Papaano kaya? Kaya ba? Pwede ba kahit sa mahirap? You know, all of those. So, tayo lahat ay makikinabang kaya. So ito ay nawala na nagkaroon tayo ng pandemya. So it's something, you know, it's something that we did not even expect it because of this pandemic. So Honorable Secretary, please allow me to ask you, now that the full implementation of the devolution has been prescribed by the Executive Order 138, kayo po ba sa LGU will be able to reconcile with the principle of the UHC when the said law shall be put on the ground for implementation? Simpler said, will the full devolution setup of the government be able to translate what is said as equitable access to quality and affordable healthcare goods and services? Sir?
We will still continue to work with DOS and capacitate our LGUs to improve their health systems. Even with next year's full devolution, the national government agencies will remain accessible to LGUs whenever they need assistance. In fact, our LGUs will also be crafting their own capacity development agenda and devolution transition plans. Meanwhile, the DILG is currently making efforts to help them develop these plans for the devolved functions, including health services.
That's really the challenge for the LGUs, but we are very optimistic that we will be able to really provide quality health care to our communities and population. Sa Department of Nurses Welfare, may nakalap kami na balita na may mga nurses daw na na-employ sa isang local government and they were promised a good salary, so they agreed to work in an LGU designated hospital.
Matapos na hindi sila nabigyan ng sahod ng ilang buwan, nag-decide sila, yung mga nurses, na umalis o mag-resign. Yung mag-resign na sila, tsaka lang sila pinapipirma ng kontrata. Ano ba yun?
Yes, totoo yan, Ma'am Shirley. Hindi ba?
Di ba dapat yung umpisa pa lang magtrabaho ka, may kontrata ka na ngayon? Ano to?
Tama. So, gaya ng common na kwento, takot ang mga nurses na ito magsalita o magreklamo. Our welfare department in fact made efforts to reach out to these nurses, pero takot sila. Takot.
Sinabi mo, it took me time to be talking with them, requesting them to write at least narrative, hindi na lang complain. Just a narrative story of what happened to them in that area. I waited for a week. Wala pa rin. I followed up, wala pa rin. So, it means, paano tayo? How can we be heard? Diba?
How can we help if these nurses will keep silent about their conditions?
That's true. Kaya ang tanong namin, Secretary, is in cases that there is a conflict and compromise between the local government and employed nurses, where can our nurses best seek assistance? Saan po sila ba pwedeng tumawag, sir?
It may depend on the issue, but it might be best to seek assistance from the DOS and the DILG. We will be reachable through our official emails and landline hotline numbers. Moreover, we often conduct consultations with the regional health officers to better understand the health concerns of those on the ground, as well as gain more ideas on how to improve the local health systems.
Thank you, Secretary, for making that clarification. Now, I hope our nurses will really be brave to go out and speak and then to really go to what is where they are supposed to go. Ang laki ng challenge, pero kaya natin. Pag-usapan naman natin ang Mandanas Ruling. The Mandanas et al. Ruling of the Supreme Court underscores how the bigger budget pie shall be sliced and placed on the hands of the LGUs.
Ang Mandanas Ruling ay nagpapatibay ng mas malalaking share sa lahat ng income at taxes or buwis sa gobyerno para sa mga local government units.
Ma'am,
Seven,
paulit nga.
alam mo yun?
Paulit nga, ma'am.
Ay, hindi na masakit sa ulo ko yung yung tinatawag na malalaking share.
Naisip ko with greater resources given.
Oo.
The greater is the responsibility for the LGUs for accountability.
Alam mo na ngayon, Ma'am Ingrid.
Accountability nga hindi ba? Ang tanong namin po, Secretary, is there some sort of corruption proofing made under terms of guidelines and procedures by the DILG in order to secure that the share for health will be rightfully and lawfully utilized and not abused? Sorry sir for the question, but siguro po dapat din namin malaman, sir.
Furthermore, with the implementation of the Supreme Court ruling on the Mandanas and Garcia petitions, our LGUs will have greater share of national taxes. Thus, they will have more budget to implement their health mandates falling under Section 17 of the Local Government Code.
Maraming salamat, Secretary, for really making us confident that there will be no corruptions under this implementation of the devolution. Ating pasalamatan ng ating mapugay at magiting na panauhin, Honorable Secretary Eduardo Anyo.
Kayo po, sir, ang naging matibay naming government resource sa usapin ng local government.
At ang PNA ay nagbibigay sa iyo ng Certificate of Appreciation para sa iyong malaking partisipasyon sa programa namin ito.
Please allow me to read the certificate nobly accorded to our guests and this reads, on the occasion of the PNA Nurses Welfare Dialogue with the theme Karapatan, Kapakanan at Kaligtasan ng mga nurse sa trabaho, the Philippine Nurses Association Department of Nurses Welfare declares its honor and appreciation to Honorable Secretary Eduardo M. Anyo, Department of Interior and Local Government.
NEAC services are designed to provide easy and fast medical licensure exam application assistance for the USA, Canada, UK, Ireland, and the Middle East since 2007. Our services include exam consultancy services, expert assistance in the application process, providing multi-level proof checking on your application, and fast application follow-ups. NEAC ensures to deliver the best quality of medical licensure exam application assistance for the best price without hidden charges. Get your medical license internationally and the exam application is up to us. NEAC, your innovative pioneer partner for easy medical exam application.
All right, so there you have them. We just heard ayan, our second Nurses Virtual Dialogue with no less than our DILG Secretary, Honorable Eduardo Anyo. Thank you very much, Honorable Secretary, for gracing the second Nurses Virtual Dialogue. Of course, hats off, mad props to the members of our Department of Nurses Welfare, headed, of course, by Nars Neil Cabo, with his members, Nars Ingrid, Nars Shirley, and of course, Nars Benj. Sa ating mga nurses, pagpupugay po sa ating mga makabagong bayani. Happy National Heroes Day to all our fellow nurses. Well, let's all together greet each and everyone a happy National Heroes Day. In line with our Nurses Virtual Dialogue Episode 2, we'll also be proceeding with our Kapihan Session 4. This is already our fourth Kapihan session. We're in our first Kapihan session aimed to tackle on the issues of our nurses regarding vaccination. Our second Kapihan session provided mental health support for our nurses. Our third Kapihan session tackled on the issues on salary grade 15. And right now, for our fourth Kapihan session, we will be highlighting our Bayaning Nurse Awardees. Of course, what better way to celebrate National Heroes Day than to hear the heroistic acts of our nurses. So on this note, ladies and gentlemen, fellow nurses and frontliners, allow me to greet each and every one of us. Maupay na aga, Sinirangan Visayas, magandang umaga Philippines, and of course, good morning world. Now, without further ado, let's go ahead and get to know our three Bayaning nurses who will grace our fourth Kapihan session. Let's start. Our first Bayaning nurse joining us today is a company nurse at Medicard Philippines and was awarded as Bayaning Nurse in the year 2020, and was awarded as the Bayaning Nurse for the year 2020. Ladies and gentlemen, fellow nurses and frontliners, let us all together welcome Nurse Mary Lorraine Pingol. Hi, Lorraine. Good morning.
Hello, sir. Good morning.
Hello, Lorraine.
Everyone. Good morning.
Thank you so much for joining us. Let's go ahead and get to know our second Bayaning nurse joining us. Our second Bayaning nurse is a staff nurse at the Philippine General Hospital for 15 years. She is a NICU nurse and she loves to call her patients as anak. Awarded Bayaning Nurse for the year 2021, we have Nars Esmeralda Ninto. Hi, good morning, Nars Esmeralda.
Good morning po.
Good morning. Joining us today as well, on this very momentous occasion, is our third Bayaning nurse. Our third Bayaning nurse is also a staff nurse at the Philippine General Hospital. It is with delight that we welcome another Bayaning nurse for the year 2021, Nars Phoebe Malabanan. Good morning, Nars Phoebe. Ay, nakamute ka pa po, Nars Phoebe. Ayan, good morning po sa ating tatlong Bayaning Nurse Awardees, and thank you very much for sparing your time to join our nurses on this momentous occasion. So, first up, Nurse Lorraine, Nurse Esmeralda, and Nurse Phoebe, kumusta kayo ngayong pandemic? How are you doing? Kumusta ang ating duty? Let's hear from Nurse Lorraine. Nurse Lorraine, kumusta ka this pandemic?
Hello. Can you hear me well?
Yes
Okay.
po.
Yeah. So, ongoing pa rin po yung pandemic natin ngayon, no? And since we have this Delta variant, naging mas mabilis ang transmission ng infection. Mas dumami yung mga positive, COVID-19 positive patients. So ako, as a company nurse, dito sa company where I'm working, marami na pong infected. And unlike before, noon kasi nung wala pa yung Delta variant, usually mga mild cases lang yung mga COVID patients ko dito na pinapauwi ko. Kasi siyempre, pero ngayon meron po yung mga nagiging moderate to severe yung kanilang infections. I don't know why. Is it because of the Delta? Well, I don't know. Pero ngayon ko po naranasan yung I had patients na kailangan nilang dalhin sa ospital, okay? Because they were experiencing difficulty of breathing already at home. COVID positive po sila, and then I tried to look for available hospitals, pero unfortunately, halos lahat ng ospital ay puno na. So that is one sad thing about our situation. And of course, bilang nurse dito sa kumpanyang ito, pasyente ko sila, I was worried about them. So ang nangyari is home care. Home care. Ako po at saka yung kapwa kong nurse dito sa company clinic, pati yung company physicians namin, kami po ang nag-alaga sa mga pasyenteng iyon on home care. And fortunately naman, they have improved, and we are happy about that. At least they were able to save money that they could have spent if they were hospitalized. Ang mahal-mahal pong ma-hospital. So yun po yung mga experiences ko ngayong taong ito during this pandemic, no? Yeah, somehow it's a challenge kasi natatakot po ako because yun nga yung ating healthcare system ay hindi maayos sa ngayon. Ayun po. Pero so far I'm enjoying my job, of course.
That's good.
I have this passion to help my patients, to serve them. Hindi po mawawala sa atin iyon.
Yes, talagang saludo kami sa iyo for having the passion. And at the same time, ika nga, di ba, Nurse Lorraine, laban lang. All right, so thank you so much, Nurse Lorraine, for sharing your current experience. How about Nurse Esmeralda? Nurse Esmeralda, kamusta ka ngayong pandemic? How are you doing? Nurse Esmeralda?
Good morning.
Hi.
Yun. So, ako naman po ay during this pandemic, medyo madami ng pagbabago kasi nga dahil sa mga protocol. Pero ako as a nurse sa Clinical ICU, mas wala ako.
We can hear you clearly. Yes.
Ayun po. Ayun, as staff nurse po sa Clinical ICU, maraming pagbabago. So, ang nakita ko lang during pandemic na medyo hard for the parents ng patient namin. Kasi pag pinanganak sila, dati nakikita sila. Ngayon po, hindi na. Especially nakikita na sila pag critical just because of the protocol, bawal ang dalaw. So, more on pictures. Yun yung medyo masakit in this pandemic na hindi na makita yung mga anak nila. Yun lang. So pero siyempre, lalaban lang. Ang lang for me naman as may family kasi ako. So, lagi ko lang worried kung baka madala ko yung virus sa bahay. Pero siyempre, sa protocol, walang susuko. Kahit pagod na, go lang ng go. Yun lang. Pero,
go lang ng go.
I make sure naman na, and I make sure during my duty, ginagawa ko lahat para to give comfort sa patient ko, and not only for my patient, sa relative, and kung ko yung mga mother na yun nga, nagbibigay ng picture na mapicturean man lang, makita na man lang nila yung mga babies nila. Kahit sa mga picture lang, sa picture lang yung for me. Tapos, yun lang. So yun nga, kaya din nominate kami due to this pandemic, yung letter ng PGH Fire last May. So, di rin namin alam kung talagang paano namin na ibaba lahat ng baby from 4th floor to ground floor. Kasi yung sunog at that time is nasa 3rd floor. So, inuna lang namin yung mga well-baby na sinikay namin sila on the ground floor. Then, may mga staff nurses na nag-antay doon, sila yung nagbantay. Then, last patient kasi, yung akin, medyo siya kasi most critical at that time. Sa 35 baby siya talaga yung medyo huli namin kasi siya yung cardiac baby na pwede matanggalan ng drip na gamot. So, alam ko siya na lang ang naiiwan since may patient siya. So parang kahit hinaharang ako ng work, akit talaga ako kasi hindi kaya ng konsensya ko na may maiiwan kahit bawal na umakyat. So pag akyat namin on the 4th floor, pag akyat ko, nakita ko yung doktor nasa bedside. Tinatry niya ayusin yung mga drip. Kasi yung syringe pump niya, 3 drip yon na hindi pwede matanggal. So sa NICU, meron kami para kaming apron na usually doon nilalagay yung baby. Pero at that time, ang nilagay namin doon mga syringe. Tapos yung baby, hawak namin, nagbabag kami, nag-ambobaging kami from 4 to 3rd to ground dun sa sister ward namin. Pero nag-code na kami during tumatakbo kami with the doctor. As in, na sinisigaw na. Pero wala, nakakatuwa kasi hindi ko alam kung saan galing yung energy na meron ako at that time. Kasi after na nagko-code, nagbabag kami, na-revive namin yung babies.
Wow!
Yes, just nakita ko nga yung nanay na na-interview during parang sa TV Patrol or whatever, na yung baby na lang niya hindi pa na ibababa. Hindi niya alam na ibaba namin, nagawa ng paraan at that time. Nakakatawa, masarap kahit pagod na kami.
Yes po, talagang ramdam na ramdam din po namin ang kasiyahan, especially with you reliving that specific moment. At talagang because of that, because of your courage to go back to the 3rd floor and save those babies, talaga pong karapat dapat kayong tawaging bayaning nurses. Thank you very much, Nurse Esmeralda. And I'm sure that Nurse Phoebe could also very much gravitate to your story. So let's all together hear the words coming from Nars Phoebe. Nars Phoebe?
Hi, good morning everyone.
Ayan, narinig na namin si Nars Phoebe. Nars Phoebe, how are you doing this pandemic? Kamusta ka?
Yes sir, very challenging po ang pandemic po ngayon, lalo na po sa aming mga nurses. Personally, sa pag-iwan pa lang po namin sa family namin at pumunta sa work, ang pagbiyahe pa lang po at sa mga restrictions, very challenging na po. Pati po ang pag-duty rin po namin sa area na we-witness po namin everyday yung mga changes and difficulties. Yan, kasama ko rin po kasi si Esmeralda si Japet po, Esmeralda Ninta sa neonatal ICU. Kasama ko rin po siya nung time na nagkaroon ng sunog sa NICU. And isa po rin ako sa mga nakasama niya na ma-save yung mga babies po na nandoon. Sobrang na-amaze po ako sa mga kasama ko dahil po halos lahat sila naging selfless dun po sa mga ginawa nilang pagtulong sa babies. Yun po, sir.
Wow, thank you very much, Nars Phoebe. So, we will dig into more details a little later with your story.
Okay, sir.
Balik naman tayo kay Nars Lorraine. Nars Lorraine. Nars Lorraine. Ayan, so talaga pong nakakabilib ang mga heroic deeds ng ating mga nurses. Ngayon po, let's dig into details, Nars Lorraine. Ayan, Nars Lorraine, ikwento mo naman sa amin, ano ba yung nangyari nung panahong yon? Paano mo ba naipakita ang iyong pagiging bayaning nurse? Ano ba ang nangyari?
Last year po iyon. That was August 18, 2020. I really remember the exact date. August 18. Umaga po, nagmamadali po akong pumasok sa trabaho. Naglalakad lang po ako. Okay. And then, while walking, tinawag po ako ng grupo ng mga kalalakihan. Nurse, sabi po nila. Alam nilang isa po akong nurse kasi I was wearing this uniform. So ngayon, nagpakilala naman sila na mga tauhan po sila ng barangay. Kaya ako naman, although nagmamadali po ako, lumapit po ako. Okay? And then paglapit ko, humingi po sila ng tulong sa akin dahil mayroon pong homeless mother na nanganak sa kalsada. Actually, nakalabas na po ang bata. Okay? Kasi nadatnan nila na nakalabas na eh. Pero however, hindi pa po tapos yung delivery process kasi yung inunan nasa loob pa. Wala pang cord care. So hindi pa po tapos lahat, no, yung aftercare ng mag-ina. Hindi po nila alam ang gagawin nila, and actually they have a nurse and midwife din sa barangay, pero at that time ay hindi po on duty at hindi rin po makontak. So parang yun nga, natuwa sila na may nakita silang napadaang nurse. And nung humingi sila ng tulong sa akin, sabi ko, tutulungan ko kayo, sabi ko. Tutulungan ko kayo. Pumayag po ako na tulungan sila. Although, deep inside me, kinakabahan po ako. Sa totoo lang. Kabadong-kabado ako dahil it was my first time to encounter an emergency situation sa daan.
Yes.
At saka, matagal po akong walang hospital experience dahil nagkasakit po ako noon ng leukemia, natigil po ako sa pagtatrabaho sa ospital, no? So, hindi po ako confident sa aking skills. But then, sabi ko, okay, I will take this challenge. Gagawin ko yung pagtulong sa mag-ina. Anyways, isa akong nurse at nag-aral naman ako. I just have to recall what I learned, di ba? And I just have to pray to God while helping them para maging successful. So, to make the long story short, ayun, naging successful po yung pagtulong ko sa kanila. After I assisted them, nag-instruct na lang ako doon sa mga tauhan ng barangay na dalhin nyo na po sila sa ospital since meron naman silang barangay ambulance. Diba? Meron naman silang mga basic tools like BP apparatus. I-monitor nyo na lang yung kanyang BP while on transfer, on transit, mga ganon. So, ganun po yung nangyari nung araw na yon, August 18, 2020. And hindi ko po inaasahan na magiging isang napakalaking balita po iyon. Hindi ko po inaasahan lahat ng nangyari pagkatapos po ng pangyayaring iyon. And to be given awards, hindi ko rin po inaasahan iyon. Yun.
So, Nurse Lorraine, during that specific moment, sinabi mo na kinabahan ka, sinabi mo na nag-alangan ka na lumapit doon sa mag-ina. Pero as a nurse, ano ba yung naramdaman mo? What motivated you? What inspired you to go ahead and proceed to help the mother giving birth and the baby? What motivated you?
Because I had what ifs in my mind, no? So, of course, nandoon po yung aking takot na baka ako ay magkamali. Hindi po ako takot na magka-COVID. Hindi po ako takot doon sa bagay na iyon. Pero ang takot ko is yung magkamali. Kasi once na nagkamali ako, I will put the mother and the child in danger. Diba? So, hindi kaya ng konsensya natin iyon. Tapos may ano din yun, may kaso pa rin. Tama? Ayun. But then I had what ifs, no? What if I didn't help them? Who would help them?
Yes.
Kasi there was no one else eh. The barangay nurse and the barangay midwife were not there. Naghahanap sila ng tutulong sa kanila. So, if I didn't help them, what will happen to them? Who else can help them? No? So, yung concern for those patients, yung mag-ina, yung concern for the mag-ina, yun po yung nag-push sa akin na tulungan ko sila. Although I'm not confident with myself as a nurse. I mean, with my skills, no? With my skills as a nurse in that situation. Nag-decide ako na tulungan sila out of my concern for them. So, nilakasan ko po yung loob ko. And prayers, of course. Yun.
Ayan, so talagang very innate sa ating mga nurses, no, to have the concern and the compassion for our nurses. Kahit gaano tayo kakinakabahan, talagang gagawin natin yon kasi nakikita natin na ang ating mga pasyente or ang mga tao ay nangangailangan ng ating tulong. And with that, Nurse Lorraine, talagang siguro your clinical instructors also deserves recognition as well kasi naalala mo pa yung mga basic skills in the delivery process at talagang isa yon sa testament na maganda ang pagtuturo nila sa iyo because naalala mo. Thank you very much, Nurse Lorraine. Let's also hear the story coming from Nurse Esmeralda, Nurse Japet, and Nurse Phoebe. Yeah, Nurse Japet.
Yes po.
Ayan, so Nurse Esmeralda, dalhin mo kami pabalik doon sa sitwasyon na yon. Ano ba yung nangyari? Paano nyo nalaman na may sunog? Ano ba yung unang naisip mo? Ano yung ginawa mo nung mga panahong yon?
Honestly po kasi, kala ko nagbibiro lang yung isang kasamahan ko na may parang usok. So parang kasi pag gabi, nagpapaligo kami ng babies. At that time, dun kasi ako sa area na mga infectious disease. So yun yung hawak ko. So parang tatlong intubated or basta hindi ko na matandaan. So kala ko nagbibiro lang. So tuloy lang ako nagpapaligo ng baby. Maya-maya, seryoso na pala. Kinakatok na kami sa room. Nasabi nila na, may sulog, may sulog. So kala ko joke lang. So lumabas ako. Kasi ko, medyo mausok na. So, ang inuna namin, dahil infectious yung baby ko, dapat sila talaga ihuli. Tapos mga medyo mas critical sila. So, ang inuna namin, iniwan namin yung baby ko sa unit. Tapos inuna namin yung mga well baby kasi meron kaming area by area. Well baby, mga cohort, and yung mga COVID positive yung mga probable baby namin. So, inuna yung mga well baby. So, naibaba na namin yung mga well baby, sinunod namin yung mga critical. Yun nga po, yung last, pero parang 4 times kami nagpabalik-balik. That time, parang post-COVID ako. So, parang hingal na hingal ako. Pero despite of my hingal talaga, hindi mo magawang, hindi na umakyat. Parang ganun. Lahat ng mga kasama ko ganun. Kasi parang ilan din kami yung nag-akyat pa ba with Ma'am Piti. Kasi yung iba talaga, hindi pwede umakyat kasi wala namang maiiwanan sa mga baby binaban. Kasi yung ibang baby namin, parang binabag nila without auto. Para lang maibaba namin, ma-safe namin yung mga batang yun. Talagang alam mo yun, yung pagtutulungan. So parang hindi lang sa amin lang na na-awardee, lahat kami ng susunod talagang ginawa yung dapat gawin. So yun, pero yun nga, yung nag-akit baba, yung last critical patient na cardiac nga na baby, na yun nga yung pinakahuli na umiyak na nga yung nanay kasi sinabi nung fellow natin na siya na lang yung naiwan sa taas. Pero as nga, patient ko siya, not only kasi patient, just because hindi talaga, kahit sino namang nurses gagawin na may maiiwan doon. Kahit sobrang pinipigilan na kami ng mga guard kasi magpa-fire out na talagang nagtanggal na sila ng mga ilaw. Pero which is, matapang hindi ko rin alam kung saan galing yung tapang kahit ang dilim nung paakyat, masyadong matarik. Hindi ko rin alam kung, basta pagdating ko nakita ko yung doktor, yung mga syringe pump ng mga gamot niya, kahit on code na hinihingal, tumatakbo kami, hindi ako, nire-revive namin siya. Parang amazing lahat yung nangyari. At after pa nung na-survive namin, hindi pa natapos yung gabi na yun kasi mga baby namin na walang ventilator, kami rin nagbabag, 2 kamay namin, binabag namin. As in, palitan, ihi ka na, kakaway ka lang for so minsan yung isang kasamahan ko, 3 na yung binabag niya kasi kailangan mong umihi, kailangan uminom for a while. Pero the best talaga, sobrang amazed. Hindi talaga namin alam kung saan galing lahat yung energy at that time. Yun lang. Lahat kami, not only awardees, for awardees kasi yung pangalan lang, pero lahat kami, that duty. Saka saludo talaga ako sa mga guard that time. Di talaga kami iniwan hanggang mababa na lahat ng duty. Kahit sumisigaw na sila na, may baby pa rin, may baby pa rito. Parang hindi nga namin kayang dalhin lahat, especially the critical. Pero nangyari na ipabala. As in, sobrang na ipabala. Nakakato.
So, Nurse Japet, di ba na-mention mo na kahit pinipigilan na kayo ng mga guard, talagang nagpupumilit ka pa rin pumasok. What was your motivation na bumalik doon? Ano ba yung nararamdaman mo?
Siguro yung passion din ng, not the passion the work as a mom, parang, alam mo yun, initiative ko na walang maiiwan. Anak ko yun lahat kasi ng mga patient ko everyday, kahit nga yung mga mommy na, kasi may mga KM si mommy kami na, pag lagi tawag ng anak-anak, parang nagsasabi na, anak mo yan lahat, ma'am. So I treat them, all my hindi ko sila treat as patient I treat them na lahat sila anak ko. So kung paano ko alagaan yung mga anak ko, ganun ko din sila inaalagaan. So, siyempre, as a mother, di mo talaga iiwan na kahit anong mangyari, kahit gaano ka-danger yan, gagawa ka ng paraan para masave sila. So, yun talaga, yung passion mo talaga as a mother.
talagang nandun po yung pagmamahal. Pagmamahal na feel mo bilang isang ina, na feel mo din para sa iyong mga pasyente. Ika nga, 'di ba, during your introduction, you call your patients as anak.
Talagang anak tawag ko sa kanila. Every baby na ang hawakan ko during my duty, anak o ano, teka lang, yung mga ganun, pinakausap ko
Aha.
talaga.
Mhm. Nakakatuwa po at talagang nakakabilib. I'm sure na makaka-relate din po sa kwento mo si Nars Phoebe. Nars Phoebe, so nung mga panahon na nag-aakyat baba sila Nurse Esmeralda, Nurse Japet, ano naman yung ginagawa mo during those times?
Ay, yes sir, opo. Isa po ako sa mga umaakyat at baba with Japet. That time kasi, ako yung charge nurse. So, yung pressure talaga, parang lahat nasa akin. Kasi para kung paano ko ba sila i-guide or i-coach kung anong gagawin. Pero nakakatuwa po kasi that time dahil hindi na po sila talaga hindi na po sila kailangan talagang i-coach kasi automatic po talaga sa bawat isa sa amin sa team kung ano yung mga ginawa nila. So, biglang automatic na yung isa, I mean everyone, meron pong mga kanya-kanyang ginampanan. Like yung mga nagbaba po ng babies, yung kumuha po ng milk, yung mga nagbantay po dun sa mga naibaba sa baba. Sobrang nakakatuwa lang po talaga yung bayanihan nga po na sinasabi nila. Na doon ko lang po talaga na naramdaman na totoo po palang ito po pala ang bayanihan na sinasabi nila.
Wow.
Ayun po sir. Mm-mm.
Tapos, nung mga panahong yun, Nurse Phoebe, hindi ka ba natakot masunog or masaktan?
Sir, sa totoo lang po, honestly po, unang-una pa lang na nakita ko po yung naamoy ang usok at nakita. Natakot po talaga din ako para sa sarili ko. Pero mas natakot po kasi ako para sa mga babies na may iwan namin doon. Hindi po kasi nila kaya yung sarili nila eh. So parang para sa akin, kailangan ko po talaga silang iligtas. Kailangan po namin iligtas. Yun po talaga yung nasa isip namin that time.
Sabi nga ni Nurse Esmeralda na kahit hingal siya during that time, hindi siya napagod.
Yes,
At
yes sir. Opo.
Ikaw din po ba ganun din po?
Yes sir, na-witness ko po. Nagulat po ako rin sa sarili ko. Paano ko po naakyat? Kasi po, pag mga ordinary times, nag-elevator po talaga ako kasi hindi ko po kayang umakyat hanggang 4th floor. Pero sabi ko, ang galing ni Lord that time. Kasi sabi ko, paano ko nagawang makaakyat baba ng parang 4 to 5 rounds ba yun? Parang ang galing po talaga nun. Hindi lang po ako, pati po ng mga kasama ko. At tumakbo pa po ang PGH po kasi medyo malayo ang mga pagitan ng mga areas. Para itakbo sa labas, balik sa taas. Ayan po. Yun po talaga ang mga nangyan.
Imagine ko lang, siguro nung times na nagtatatakbo ka, meron kang dalang-dalawang bata.
Yes, sir. Hindi ko po talaga makakalimutan yung isa pong intubated baby na sa totoo lang nakakaiyak yung moment na yon kasi pinagpilian ko pa po silang dalawa kung sino po kaya ang una kong ibababa. Parehas pong intubated, kumbaga ba critical po parehas. Pero alam ko po kasi talagang ibabalik sa kasamahan ko. So kinuha ko po yung isa at habang pababa po kami sa hagdanan, binabag ko po siya nang wala pong O2. So, pinakausap ko po siya, sabi ko, kayanin mo baby, kayanin mo. Tatakbo ko, pero yung takbong safe po. Kaya natin ito makaabot din po sa sister ward po namin, na kung saan may mga O2 ports at may mga makakatulong po sa amin. So, sobrang natuwa naman po ako nakaabot po siya. At actually, lahat po ng babies, ang galing din po nung time na yon. Actually, marami kaming critical babies that time. Pero, naibaba namin lahat yun. Sobrang galing po ng team talaga namin. At nagpapasalamat po talaga ako sa kanila, sa lahat ng tumulong.
Wow, ayan, di ba? So, imagine bumababa ka, you had to protect not just yourself but the baby as well.
Yes, sir.
You had
Opo.
to ensure na lahat ng steps mo sa hagdanan ay sigurado. You had
Yes,
to ensure
sir.
na walang mga debris,
Opo.
wala kang makakaano na tao. At saka you
Yes,
had to
sir.
ensure
Opo.
that you had to place the baby in a safe place. So with that
Yes,
po,
sir.
with your courage, with that being selfless, you really deserve to be called our bayaning nurses. So balik naman tayo kay Nurse Lorraine. Ayan, Nurse Lorraine. Si Nurse Lorraine po ay nagpaanak sa kalye, 'di ba? Wala sa clinical setting. Nagpaanak si Nurse Lorraine sa kalye last August 18, 2020. Nurse Lorraine.
Yes, sir.
So Nurse Lorraine, how does it feel to become a bayaning nurse, na matatawag ka talaga na isang bayaning nurse? Hindi lang ito about the award, but you being a bayaning nurse. How does it feel?
Ano po ba? I feel humbled. I feel both honored and humbled, no? Kasi sa totoo lang po, I never see myself as a hero. Kasi every nurse will do that eh. I mean, anyone will help someone who is in need as long as he or she is capacitated to help, di ba? So, to me, isa po akong nurse na ginawa ang aking tungkulin. Di ba? It's not actually I was not in my job, di ba? Hindi yun parte ng aking job description as a company nurse. Hindi po ako nagtatrabaho sa barangay. But then isa po tayong nurse and meron po tayong sinumpaan na tutulungan natin ang ating kapwa sa oras ng pangangailangan, di ba? Nursing kasi is a gift to humanity eh, no? It's not just a profession or a job. So ako naman since ganun yung aking paniniwala, I just did what I knew that I had to do during that time. Pero hindi ko po nakikita na isang bayani iyon. But then to the eyes of many people, isa raw pong bayani. So, syempre, hindi naman natin kontrolado kung anong iniisip ng ibang tao, 'di ba? So ako po ay natutuwa at nagpapasalamat sa inyong lahat na natuwa doon sa aking nagawa para sa mag-ina at ganun kalaki ang inyong appreciation sa akin to the point na tatawagin niyo akong isang bayani. Pero sa totoo lang, isa lang po akong hamak na nurse. Hindi po. Isa lang po akong hamak na nurse. Ayun po.
Isa ka pong hamak na nurse na naglakas loob, na tumulong, and you were able to save 2 lives because of that courage. And with that, Nurse Lorraine, lahat kami ay hindi lang natutuwa, kaming lahat ay namamangha, kaming lahat ay believe dahil sa kadakilaan na ginawa mo para sa mag-inang yon. Maraming salamat, Nurse Lorraine. How about Nurse Phoebe? Nurse Phoebe, after being able to save all those babies, how does it feel? How does it feel to be acknowledged with that heroic deed? How does it feel to be a
Yes,
bayaning
sir.
nurse?
Sir, ang bayani po ay parang napakalaking word para sa akin. So, sobrang na-flatter and overwhelmed po ako. Parang medyo nalulunod po ako sa word na bayani. Pero kasi sobrang natutuwa naman po ako sa pag-recognize po sa ginawa po ng team namin. Pero para sa akin din po kasi, bayani rin po ang tingin ko sa teammate ko sa pag-save po sa mga babies. Kaya po sobrang thankful din po ako at na-recognize po din ng tao yung ginawa po namin. Pero sa totoo lang po din kasi, natural naman po sa pagiging nurse din po, ang una nga po pag-serve at yung pag-save po talaga, natural din po sa atin. Kaya po sobrang salamat din, sir.
At
In
kaming
behalf
lahat
po
ay
ng team,
nagpapasalamat.
yes namin. Yes, sir, opo.
At kaming lahat, Nurse Phoebe, ay nagpapasalamat. Mas nagpapasalamat kami sa inyo for taking the courage and for taking on that siguro dangerous task for you to be able to save all those helpless babies. Because if you didn't have that courage and if you didn't have that strength, then we just don't know if what would have happened to all those babies in the NICU. With that, maraming salamat.
Yes, sir. Thank you so much, sir.
How about si Nars Esmeralda? Nars Esmeralda, ayan, isa kang bayaning nurse. How does it feel to become a bayaning nurse, Nars Esmeralda?
Okay lang, parang doon pa rin naman nagsisingkin na parang na-nominate ako as bayaning nurse. Kasi nga, parang for me, ginawa ko yung duty ko and love ko doon sa mga batang pinag lang. Pero yun nga po, nagpapasalamat po ako kasi ni-recognize yung nagawa namin lahat. So yun lang, parang parang masarap sa feeling namin lahat kami na na-recognize kami yung sa pagod and sa love yung ng trabaho namin. Pero di namin ginawa, yun for me, hindi talaga yung ginawa. Parang yung ginagawa mo yun, wala yun sa isip mo na ma-recognize ka or hindi. Ginawa namin yun because of love. Yun lang.
Wow.
Pero yun, natatawag kaming bayani. Pero hindi pa rin nasisinkin sa alam ko ginawa ng tao. Parang gano'n.
Yes. Yun talaga ay isang heroic act, Nurse Esmeralda, na hindi lahat ng tao ay kayang gawin. So with that, Nurse Esmeralda, do you have any message for our nurses who are still continuing to battle this unseen enemy amidst the danger of the COVID-19 pandemic? We are all still sailing and battling this virus. So any message for our nurses?
For my co-co nurses, despite of this pandemic na talagang kinakain mga natin, maging sumunod lang sa protocol, continue what we're doing, kasi hindi tayo mapipigilan ng virus. Yung love natin to take care other people, to serve other people, ay nandyan na yan sa atin. Despite na kahit gaano ka delikado yung virus, as long as tumaano ka sa mga protocol, sinusunod mo, at hindi ka nakakalimot magdasal, yun, the best yun para for us na motivate sa ibang sa nurses at sa akin mismo, sa sarili ko. Yun lang, parang keep going, walang susuko, matatapos dito.
Walang susuko. Yan, keep going, walang susuko. Ika nga ni Nurse Esmeralda. Salamat. How about Nurse Phoebe? Do you have any message for our nurses?
Yes, sir. Unang-una po, sir, sobrang gusto ko lang sabihin sa lahat ng nurses na katulad ko ang incredible sacrifices na ginagawa nila everyday. Almost everyday, sir, nawi-witness ko kasi itong mga nurses na to, yung hardships nila, challenges. Pero kinabukasan, babangon na naman at papasok ulit. Kaya natin to. Alam ko yung mga pinaglalaban natin at ipagdasal natin na sana matugunan. Marami naman tumutulong sa atin para ipaglaban yung nararapat sa ating lahat. So alam ko naman kahit na may mga pinagdadaanan tayong ganito, itutuloy pa rin natin yung service na sinumpaan natin. Yun, at tama, mag-pray lang tayo at kaya natin to, go lang din.
Go lang ng go, di ba, Phoebe?
Yes, sir.
Maraming salamat, Phoebe. How about Nurse Lorraine? Nurse Lorraine, any parting words or message for our nurses?
Hello. Yes, so ang aking pong mensahe para sa lahat ng nurses is first, thank you. Thank you kasi kahit nahihirapan tayong lahat ngayon, lalo na yung mga nurses na nagtatrabaho sa ospital, sila talaga yung pinaka at risk of getting sick, no? Salamat because you choose to continue what you do for our patients, no, for our fellow men. And second, so first is thank you. Second is let us continue praying. Let us continue praying. I know na hindi madali yung pinagdadaanan nating lahat ngayon, And then salary is hindi okay, benefits hindi okay, 'di ba? Marami tayong issues ngayon. But then let us continue praying na sana lahat ng concerns na meron tayo ay ma-resolve na. Okay, yung hinihingi nating benepisyo, yung hinihingi nating patas na treatment for nurses and other medical workers ay sana maayos na, maibigay na. So yun, let us continue praying for that and let us continue praying na sana ay matapos na rin itong pandemic na ito. So, yun lamang po yung aking mensahe. Thank you. Continue what you are doing. Let us continue what we are doing for our fellow men and let's keep praying.
Yes, let's continue what we are doing and let us all keep praying. Thank you very much, Nurse Lorraine, for sharing your heroic act. Si Nurse Lorraine po ay nagpaanak sa kalye. Ayan, na hindi niya kilala yung pasyente, basta nagpaanak lang siya. At sila Nurse Esmeralda at Nurse Phoebe naman po ay isinalba ang mga babies na admitted sa NICU ng Philippine General Hospital when the fire broke. And in that heroic act of Nurse Lorraine, there was compassion and concern. In that heroic act of Nurse Esmeralda, there was love. And in that heroic act of Nurse Phoebe, there was courage. Compassion, concern, love, and courage. These are all the virtues of a nurse. At dahil dyan po, nararapat na tawagin lahat ng nurses na mga bayaning nurse. On this note, thank you very much to Nurse Lorraine, Nurse Esmeralda, and Nurse Phoebe. Let's all together hear the message coming from our PNA National President. We direct the spotlight to President Melbert Reyes. Pres. Alrighty, so I think that Pres Melbert is still having some technical difficulties. Meantime, ladies and gentlemen, fellow nurses and frontliners, for the Philippine Nurses Association to pay tribute to the heroism of our nurses and all healthcare workers, we dedicate to you this video.
Hubarin ang takot sa iyong damdamin, ipamalas ang angking galing. Tumayong buong tapang, harapin ang buhay, akapin ang tagumpay. Tulungan ang kapwa't bigyang halaga, huwag hatakin ng pababa. Isipin huwag sana ang sarili lang, pakisama't bayanihan. Subukan nating isulong at ligawan ang magandang bukas. Ikaw at ako magkasama tayo sa lubungin ng kinabukasan. Mandirigmang Pilipino, dakila ang lahi ko. Bayaning Pilipino sa makabagong panahon. Halina't hawakan ng aking kamay, sabay abutin natin ang tagumpay. Patuloy lang tayo sa pagpapanday, tiwala sa Diyos ang sandat at gabay. Subukan na ating isulong at ligawan ang magandang bukas. Ikaw at ako magkasama tayo sa lubungin ng kinabukasan.
Wow, that video presentation is given credit, of course, to Nurse Ralph Montes Claros, proudly from the Eastern Visayas Medical Center, along with, of course, Nurse Conrad Coral. At this point, let's get to hear the message coming from President Melbert Reyes. Press.
Yeah, good morning sa lahat at happy National Heroes Day to all our Filipino nurses here and abroad. No? Maraming salamat BPPD, Alpon at sa ating Nurses Welfare Department for this great dialogue with the DILG Secretary Anyo. No? So sabi nga ni Dr. Tedros Ghebreyesus of the Department of the World Health Organization, no country, hospitals, or clinic can keep its patients safe unless it keeps its health workers safe. Kaya naman nagpapasalamat tayo sa mga bagong development ng kwento ng Salary Grade 15 with the DBM Circular 2021-2. Binigyan linaw nito, no, at binigyan ng pag-asa ang nursing community na malapit na nating maranasan at kumbaga malapit na nating makamit itong pinakahihintay natin tagumpay sa Salary Grade 15. Bagamat alam naman natin na hindi dito nagtatapos yan sapagkat marami sa ating mga kasamahan ang pinilit pinapirma ng bagong kontrata bago pa man ma-implement ang DBM Circular 2021-2. With the DILG Secretary we are hoping na maibalik po ang mga posisyon na ito na kinuha panandalian sa aming mga kasamahan na nagpahina ng kapit nila sa laban at magpatuloy upang maging sandigan ng ating mga kapong Pilipino ng mga hospital bed because of this COVID-19. No? Bagamat sa kabila ng lahat ng na-experience, ang dami-dami na nating naranasan at na-experience dito sa COVID-19, ay marami pa rin ang nananatili sa hospital at sa near the bedside of our patients, of our fellow Filipino, no, para maglingkod at magserbisyo. Kaya naman, saludo po ang Philippine Nurses Association sa inyo at lubos-lubos ang aming pasasalamat sa inyong pananatili, sa inyong pagbibigay ng serbisyo at pagsasakripisyo. Hindi po namin sasayangin ang lahat ng efforts na binibigay nyo upang maglingkod sa ating bayan sa pamamagitan ng patuloy na pagdulog sa mga ahensya ng gobyerno upang dalhin ang mga hinaing, ang bawat sigaw na dinadala nyo sa amin. No? Wag po tayong panghinaan ng loob. Alam po natin kung gaano kahirap, no? ang maglingkod ngayong panahon nito. Subalit wala pong ibang gagawa niyan kung hindi tayo. Kaya naman, tuloy ang laban, tuloy ang pagmamahal sa bayan, tuloy ang pagsiservisyo. Dakilang Filipino nurses. Magandang umaga po at Happy National Heroes Day.
Yes, thank you very much, Press. Happy National Heroes Day. Maraming salamat, our PNA National President, Sir Melbert Reyes. Now, in line with the words coming from our PNA National President, allow us as well to grab this opportunity to thank these people who made our session for today a huge success. First and foremost, our DILG Secretary, Honorable Eduardo Anyo. Thank you very much po for sparing time. By the way, just a disclaimer po sa ating mga nurses, our nurses virtual dialogues were taped last June pa po. Okay, once again, just a disclaimer, we would want to highlight that our nurses virtual dialogues were taped last June 2021. And then ngayon po natin sila ini-air because we still had to undergo approval from our legal counsel, from our legal person, Attorney Nakara, and of course, of a panel. Again, we would want to clarify that our nurses virtual dialogue was taped last June 2021. All right. Of course, we'd also want to say thank you as well to our ever dynamic Department of Nurses Welfare headed by Nars Neil Cabo, along with his members, Nars Ingrid, Nars Shirley, and of course, Nars Benj. We'd also want to say thank you as well to our bayaning nurses who graced their presence to share their stories and inspire our nurses. Maraming salamat po, Nurse Lorraine, Nurse Esmeralda, and of course, Nurse Phoebe. Maraming salamat din to Governor Doris Obias and Governor Clement John Navarrete for coordinating with our bayaning nurses for them to be able to participate in this session. Maraming salamat din po sa ating mga department committees and of course to our President, Chairperson, Governor George Lim, and to our fellow Board of Governors. Maraming salamat po once again to Mr. Ralph Montesclaros and Mr. Conrad Corral, along with the other frontliners of the Eastern Visayas Medical Center for that tribute video. On this note, ladies and gentlemen, once again, it has been an honor facilitating this second nurses virtual dialogue in the fourth Kapihan session. This is yours truly, Nurse Alphon Giliardi Daga, the current National Vice President for Programs and Development of the Philippine Nurses Association, saying thank you everyone for being with us, and we all greet our nurses. Happy National Heroes Day. Have a great day, everyone. Enjoy.
Hubarin ang takot sa iyong damdamin, ipamalas ang angking galing. Tumayong buong tapang, harapin ang buhay, akapin ang tagumpay. Tulungan ang kapwa't bigyang halaga, huwag hatakin ng pababa. Isipin huwag sana ang sarili lang, pakisama't bayanihan. Subukan nating isulong at ligawan ang magandang bukas. Ikaw at ako magkasama tayo sa lubungin ng kinabukasan. kamay, sabay abutin natin ang tagumpay. Patuloy lang tayo sa pagpapanday, tiwala sa Diyos ang sandat at gabay. Subukan nating isulong at ligawan ang magandang bukas. Ikaw at ako magkasama tayo sa lubungin ng kinabukasan.
Congratulations po. Thank you po sa ating mga
Nakastop na po,
guests,
no?
Sir Alphonse,
Nakastop na po
Sir
yung
Albert, thank you
streaming
po.
natin, ma'am.